10 foods can trigger nausea, reflux, pressure, or bloating while using Ozempic, which contains semaglutide, or Mounjaro, which contains tirzepatide. These foods backfire when slower stomach emptying meets fat, volume, spice, acid, or gas-producing fiber. Fried food, fatty meat, and oversized salads are common offenders. The hardest meals usually combine several triggers, especially fat, large portions, and late-night eating. These medicines reduce appetite partly by slowing stomach emptying. Food stays in the stomach longer, so a normal meal can feel unusually heavy. Fat delays emptying further, large portions stretch the stomach, and gas-producing foods create pressure in the intestines. Symptoms often appear after starting treatment or increasing the dose. Nausea may arrive first, followed by burping, fullness, reflux, or bloating. The medicine may be working, but the meal can still exceed what your stomach handles comfortably. A food that felt harmless before treatment may suddenly feel very different. The goal is not a permanent forbidden food list. Identify likely triggers, then adjust portion, texture, timing, and preparation. Responses vary with dose and timing. The first offender is deep-fried food. French fries, fried chicken, onion rings, and donuts pack fat into a small volume. Fried food is easy to eat quickly, so a small-looking portion can still feel heavy. Choose a smaller serving, eat slowly, and avoid pairing it with another rich food. The second offender is fatty meat. Bacon, sausage, ribs, brisket, and heavily marbled steak deliver a large fat load before the plate looks unusually big. Their richness can intensify fullness and nausea, especially at dinner. Replace part of the portion with chicken, fish, turkey, eggs, or lean beef. Protein still matters during weight loss, but your stomach does not need the entire target at once. Spread protein across meals when larger servings cause pressure. Chew thoroughly and stop before feeling stuffed. Very fatty protein may worsen symptoms. The third offender is creamy, high-fat food, where fat hides in smooth sauces and soups. Alfredo sauce, rich cheese dips, and buttery casseroles are easy to eat quickly because they feel smooth. Their richness can leave lingering fullness afterward. Use less sauce, choose a lighter base, or divide the meal into 2 smaller portions. The fourth offender is pizza. Pizza combines cheese, oil, processed meat, tomato sauce, and a large white flour crust. Cheese and processed meat add richness, tomato adds acid, and several slices add volume. 1 or 2 slices with a lighter side are usually easier than a large late-night meal. The problem is rarely one ingredient alone. A meal becomes harder when fat, acid, spice, and volume arrive together. A modest portion may feel manageable at lunch, while a larger version causes reflux after dinner. The fifth offender is spicy food. Hot wings, chili oil, spicy noodles, and heavily seasoned curries can irritate an already sensitive upper stomach. They do not slow emptying as much as fat does. Reduce the heat first, then reintroduce it gradually after symptoms settle. Tolerance often depends on dose, meal size, and whether spice arrives with a fatty meal. You may tolerate mild seasoning, but not chili oil layered onto fried food. Change one factor at a time so you can identify what actually caused the reaction. Spice is not the only surprising trigger. Some nutritious foods can cause more discomfort than less nutritious choices when the stomach is sensitive. Health value and stomach tolerance are different questions, so preparation and portion still matter. The sixth offender is acidic food. Tomato sauce, citrus, vinegar-heavy dishes, and pickled foods can worsen burning or sour reflux. Acidic foods do not trigger symptoms for everyone, especially in small portions. Reduce the portion and avoid combining acid with a fatty or spicy evening meal. A small orange at breakfast may feel fine, while tomato-heavy lasagna at night may not. A food name alone cannot predict tolerance. The complete meal, timing, and combination matter more than one ingredient. The seventh offender is a very large raw salad. Cabbage, broccoli, cauliflower, onions, and kale can produce more gas in sensitive people. Raw vegetables also preserve more texture and bulk. Start smaller, or replace part of the salad with cooked carrots, zucchini, green beans, or spinach. Cooking softens vegetable texture and reduces the bulk of a serving. That can preserve nutrition without forcing a large raw volume into one meal. Increase the portion slowly after symptoms improve, rather than abandoning vegetables completely. The eighth offender is beans and lentils. They provide protein, minerals, and fiber, but gut bacteria break down part of that fiber and create gas. Slower stomach emptying can combine with intestinal gas, making your abdomen feel swollen. Start with a small serving and increase only if tolerated. The main pattern is simple. One mild trigger may be manageable, but several triggers together are more likely to cause symptoms. A rich dinner with spice, acid, a large raw salad, and dessert can overwhelm a stomach that handles each item separately. The ninth offender is sugar-free candy and protein snacks containing sugar alcohols. These sweeteners add sweetness with little or no sugar, but some are poorly absorbed. They can pull water into the bowel or ferment, causing gas, cramping, or diarrhea. Check the label and reduce the serving before blaming the medicine alone. Several bars, candies, or gums can deliver much more sugar alcohol than expected. A product may be low in sugar, yet still cause major digestive symptoms. Portion size matters even when the front label looks healthy. The 10th offender is a large sugary dessert. Cake, ice cream, milkshakes, pastries, and oversized cookies combine sugar, fat, and volume. That combination, not sugar alone, is why dessert can trigger nausea and reflux so quickly. Choose a smaller portion and avoid adding it after an already heavy meal. A small dessert after a light meal may feel different from dessert after dinner. Eating sweets rapidly can outrun fullness signals. Slow down before habit pushes you past fullness. The medicine cannot protect you from rich food, eaten after you already feel full. Tolerance also changes after dose increases. Symptoms often become stronger after an increase, even when the same meals were previously tolerated. During that period, use smaller meals and simpler combinations. Avoid testing several trigger foods in one meal, even if each one seemed acceptable alone. Meal timing changes risk as well. Finish dinner several hours before lying down when reflux is a problem. Eat slowly, chew well, and pause halfway because fullness can appear later than expected. Stopping early is easier than trying to reverse nausea after the stomach becomes overfilled. Fluids help, but large drinks with meals can add uncomfortable volume. Sip through the day instead of chugging beside a heavy plate. Carbonated drinks may add gas and belching. Very sweet drinks can deliver calories rapidly without giving your stomach much useful nutrition. Food changes are not enough when symptoms become severe. Persistent vomiting, severe abdominal pain, inability to keep fluids down, or signs of dehydration need medical attention. New severe pain that spreads to the back also deserves prompt evaluation. Do not keep increasing the dose while significant symptoms remain uncontrolled. The practical answer is recognizing patterns, not fearing 10 foods. Start with smaller, lower-fat meals and use cooked vegetables when large raw salads cause pressure. Limit stacked triggers, especially at night. Then reintroduce foods one at a time, using comfort and nutrition as the guide. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.